All right, so in this video, we're actually going to go back to talking about the streptococci. I know I've mentioned the streptococci before. We've done group A strep, we've done the viridian strep, but we've done group D strep. And we kind of skipped over group B strep, which since we're in the brain and behavior block for now, I'll refer to it as kind of the other GBS because recently I did the Guillain-Barré syndrome, which if you talk to a neurologist and you say, oh, well, it's GBS. That's what they'll think about instead of microbiology. But anyway, so group B strep is also known as Streptococcus agalactiae. Remember, whenever we talk about the streptococci, you absolutely have to know both the group name and the Latin name. That's really key. So we're going to go into some of the main characteristics, but since it's been a while since we've talked about strep, let's start with some of the main characteristics just of the group as a whole. Okay, so group B strep, Streptococcus agalactiae, it's the only species in the group B strep. We've talked about strep before. Strep in general are just these gram-positive cocci, right? And they tend to arrange themselves in pairs or chains, as I'm showing here. If you grow them on blood plate agar, they'll actually appear as kind of small, colorless colonies. All of the strep are aerobic, but they can be facultatively anaerobic. And they're able to grow on blood agar where they show a distinctive hemolytic pattern, which can actually be used to differentiate them. And like all streptococci, they are catalase negative. And this is a huge differentiating factor from our staphylococci, which are the other main gram-positive cocci, which are catalase positive. Okay, so let's remember all of that and then apply it to these group B strep. Okay, let's remember why I'm even saying group B strep. Remember that the streptococci and the enterococci basically have these extra carbohydrates on their surface that we can detect by the types of antibodies that are made, and these are called Lancefield groupings. So the group B streps, they basically find all of the B antibodies. That's a really simplistic answer, but you can kind of think of it that way. The other things that we use are basically the hemolysis, which I touched on the last slide. So basically, what does it look like on blood plate agar? Is it beta, alpha, or gamma? For group B strep, it actually happens to be beta. And then there are certain biochemical tests. So we already talked about catalase, but the main test for group B strep is actually CAMP test. So we'll talk about what that means again in a minute. Okay, so what is group B strep? Well, when you think about group B strep, I want you to remember that B is for babies, because this is the patient we are most concerned about when we think about group B strep. We used to worry actually about something else with strep. With group A strep, we used to worry about child bed fever or puerperal sepsis, which isn't as common anymore, thankfully. This was a devastating invasive infection, caused epidemics of maternal deaths in childbirth wards, and it was actually found to be transmitted by doctors and med students who were not properly washing their hands between patients. However, streptococcal infections, while thankfully child bed fever is not common anymore, the important major role that they play in maternity wards across the country is actually due to group B strep. It is an important cause of septicemia, pneumonia, and meningitis in newborn children. And for this reason, pregnant women are actually tested to see if they carry group B strep in the vaginal canal, where it is part of the normal flora of approximately 20% of women. And whenever possible, women who are GBS positive should be treated with intravenous penicillin for approximately 4 hours prior to delivery. So what are the main characteristics? Well, like I said, it's normal flora. Just like the other strep, it's going to show up in short chains in clinical specimens and maybe longer chains in cultures. It's a beta hemolytic organism, but it's CAMP factor positive. So what does that mean? Basically, CAMP factor, this is not cyclic AMP. This is named for the 3 scientists who discovered it, Christy Atkins and Munch Pedersen. Sorry, can't pronounce that right now, but Christy Atkins and Munch Pedersen. So together that spells CAMP. And basically what it is it's looking for a cofactor. So they found that when they streak a line of Staph aureus and then have a line of group B strep meet it, you get this arrowhead, which is basically an enhanced zone of beta hemolysis that you don't see with, say, an organism like group A strep. So when you have a CAMP positive organism, it will exhibit this enhanced zone of beta hemolysis when it happens to touch Staph aureus on a blood agar plate. Okay, so as I mentioned before, it's a very important pathogen that causes pneumonia and specifically meningitis and sepsis in neonates. Infection occurs in approximately 60% of infants that are born to group B strep positive mothers. Basically, the babies are colonized at birth as the baby goes through the vaginal canal, right? So they're just kind of contracting it on their way out. So you kind of have two options of how this might present. So there's early onset. If it occurs within 1 week of the child's birth, it's called early onset. It's characterized by pretty high bacteremia. Patients also exhibit signs of pneumonia, and the big fear is obviously meningitis. So you'll do an LP, and you're going to see that characteristic bacterial meningitis CSF profile. That's basically going to show the reduction in glucose and the increase in protein and PMNs. The mortality rate is less than 5% as long as we diagnose it quickly. But even though patients do not die, approximately 15 to 30% of patients actually experience some long-term sequelae. And this can include things like blindness and deafness, as well as cognitive disability. So, certainly not without its consequences. Late onset is also possible. This is anything that occurs after that 1 week mark through about 3 months of age. Once again, we're looking at that bacteremia and meningitis. Meningitis more than the pneumonia at this point. Mortality rate here is a little bit lower. It's as low as about 3%. But unfortunately, the neurologic complications tend to be more common. So we go up to about 50% of patients experiencing some form of long-term neurologic sequelae. The good news is that we can actually prevent this one pretty effectively. It is susceptible to penicillin, and that is currently the drug of choice. Last I checked with OB, they were screening patients between their 36th and 37th week prior to delivery to determine if they were group B strep positive. Sometimes that changes. A couple years ago, it was 35. Now it seems they're getting closer and closer to that D date. But if that's the case, all of your, birth mom's plans of like giving birth in a pool of water while, I don't know, harps play in the background, could go right out the window, because it would be really important to have that penicillin IV drip to kind of keep you and baby safe. But as long as you do that, all is well and baby will be safe. So that's all I have on group B strep. Make sure to watch the meningitis video to get a better understanding of what bacterial meningitis is if you haven't already. Thanks.